Good morning, Rangers! Welcome back to our channel. I'm Vince,
Ian,
and we are the Rangers of Motion. So for last week's episode, we discussed about
adhesive capsulitis or the frozen shoulder, and now we're going to talk about
the tightness of the hip flexors or the hip extensors. So watch this video and learn from it. So for this week's episode, I'll be representing as a physical therapist and Ian will be the patient with the condition of limited hip flexion and extension. So to increase his limited range of motion, I'll be performing different kinds of exercises on him. But before doing those exercises, we must first assess the patient's condition, namely by active range of motion and the passive range of motion as seen from this clip. Watch this. We begin this session by greeting our patient courteously and explain to him the activities to be done. Also, we must not forget to tell our patient that some of the exercises will require manual contact. After doing the rationale of the activities, we will begin by checking his gross range of motion to assess which lower extremity has a limitation. To confirm these limitations, we will now proceed to the active range of motion. To do this, we will be asking our patient to lie in supine and ask to flex his leg. While for extension, he must lie in prone. As the activity is done, we check the range by using a goniometer. To use a goniometer for checking the range of motion of hip flexion, we will be using the greater trochanter as the fulcrum, the lateral midline of the pelvis as the proximal arm, and the lateral epicondyle as the distal arm. If you are asking, what is the hip's full range of motion in flexion and extension, we will be following the American Association of Orthopedic Surgeons Guide, which is 0 to 120 in flexion, while in extension it is 0 to 20. As we can see, our patient has a limited range of motion in flexion and extension due to the large difference with the normal range of motion. After the active range of motion, we will be checking for his passive range of motion. Next for this, after checking the ROM, we proceed to manual muscle testing. In this case, we check for the muscle strength of the hips if there is weakness. If not, the limitation of motion could be caused by the tightness of the muscles. Before proceeding to manual stretching, if available, we could apply a hot moist pack if there are no contraindications, and remember the precautions also. Applying hot moist pack will be for 20 minutes, and remember to tell the patient that he will be experiencing a mild, comfortable warmth. And for every 5 minutes, you gotta check for blanching. And after that, we could proceed to the stretching. And now, for the next step of the treatment, we will be stretching the hamstrings by flexing the leg with a 15-second hold with 3 reps for 3 sets once a day. While for the quads, we will be extending the hip joint. Take note, it is better to cradle the patient's knees and let the distal part of it rest at the shoulders. Stretching of the quads will just be the same as the hamstrings with a 15-second hold, 3 reps for 3 sets once a day. Also, the increase of motion does not happen right away. It could happen after several sessions of the therapy or exercises. After stretching, do the post-assessment and check if pain was elicited or if the patient has any questions or needs. Then, proceed to introduce a home exercise program so that the patient could do the exercises and stretching at home. And that's all for today, Rangers. I hope you learned a lot from us today, and we hope to see you next week again on our weekly vlog. And again, we are the Rangers of Motion.